Good evening, ladies and gentlemen. At the outset, I would like to thank Diabetes India for having this session here, and I bring you greetings from Sir Gangaram Hospital. So, metabolic associated steatotic liver disease or MASLD is not just a liver disease, but it is much more than that. So, in any diabetes conference, you would have seen this map where India is at the top in diabetes prevalence at around 11 to 12% of population has diabetes. But apart from this map, we also need to be cognizant of another map, that is fatty liver disease map. And according to most estimates, India is again at the top with about 39% of prevalence of fatty liver or MASLD in our adult population. So what are the implications of MASLD? So as Dr. Nawal already mentioned, that MASLD or fatty liver disease has got a bi-directional association with diabetes as well as obesity. So patients with MASLD may develop diabetes, and also patients with diabetes may develop MASLD, and these two can go hand in hand. Apart from that, it has been now amply proved that apart from the liver outcomes of MASLD, that is cirrhosis and liver cancer, the patients with MASLD have increased mortality due to cardiovascular diseases. So patients of MASLD, this is have been amply shown that MASLD or the fatty liver is an independent predictor of development of cardiovascular disease. So when talking about specialists, since MASLD is very common, so most of the time primary care physician would be the first person encountering these patients, because 40% of the Indian population has got fatty liver disease. And then these primary care physicians need to screen for diabetes, need to screen for cardiological manifestations as well as significant liver fibrosis. So why should a primary care physician worry so much about fatty liver or the MASLD? This is a study which was done in our department, and we have sent this manuscript for publication, that MASLD is a harbinger of cardiometabolic risk factors. So we analyzed about 600 patients who presented to us with fatty liver disease, and we found that about 99% of them had abdominal obesity. 87% of them had clinical obesity, then 63% had dyslipidemia, 56% had either pre-diabetes or diabetes, and 36% had hypertension. So all these cardiometabolic risk factors were there, and most importantly, all these were coexisting. So about 30% had three cardiometabolic risk factors, and 33% had four cardiometabolic risk factors, and about 16% had five. Very few had only one or two cardiometabolic risk factors. So basically, patients who have MASLD, there is an overlap of various cardiometabolic risk factors like hypertension, dyslipidemia, and as the age advances, the proportion of these patients or these risk factors also advances. So this is a paradigm. So it's very common to see patients who present with fatty liver disease, and we must screen them for various cardiometabolic risk factors to prevent various outcomes: coronary artery disease, stroke, chronic kidney disease, cirrhosis, obstructive sleep apnea. So basically, a diagnosis of mast cell fatty liver gives us an opportunity, gives the primary care physician an opportunity to screen for serious cardiometabolic risk factors. So why should a diabetes specialist worry so much about fatty liver or mast cell? We all know that diabetics have high prevalence of fatty liver disease, about 50 to 60%, 68% of diabetics have fatty liver disease. And also, if the diabetes has fatty liver disease, the liver fibrosis progression is faster. So as compared to patients who have fatty liver disease with diabetes, the liver fibrosis progression to cirrhosis would be faster as those who have fatty liver but without diabetes. So diabetes is a significant risk factor for liver fibrosis progression. So how do we evaluate a patient of mast cell? This will be discussed in detail, but in brief, I would like to say that all patients of fatty liver disease, we should not consider them just having a liver disease. Basically, we should screen cardiometabolic risk factors in these patients, screen for diabetes, dyslipidemia, hypertension, obesity, and we should be very cognizant of vigilant about cardiometabolic outcomes. Many of these may be having significant coronary artery disease or are at risk for stroke and other diseases. And so it is now recommended that patients with mast cell should also be screened for atherosclerotic cardiovascular disease using various risk calculators which are available in our mobile apps. And how do we evaluate for severity of liver disease? So for this, we must understand what is the most important factor which determines the hepatic outcome in these patients. So mast cell has got three components. The patients has got fatty liver, that means increased fat in the liver or steatosis. They may have inflammation in the liver, and they may have fibrosis. So although liver biopsy is the gold standard test for detection, but we do not actually advise liver biopsy to these patients. But there are other ways to actually non-invasively detect all the three components. Ultrasound can detect the amount of fat in the liver. Fibroscan also, the cap in the fibroscan can also detect, and also MRI PDFF in the research setting. And then there are various inflammatory markers. Simple liver enzyme, AST, ALT, can tell us that if some inflammation is going on in the liver. Although it's not very sensitive, but still if it is high, then at least it can inform us about inflammation. Then CRP, high sensitivity CRP, ferritin, TNF alpha are other inflammatory markers which can tell us about inflammation going on in the body as well in the liver. For fibrosis assessment, the most simplest is the blood-based biomarker, that is FIB4, which just has AST, ALT, and platelet. Apart from that, if fibroscan is available, then nothing beats it. It's one of the best non-invasive tool to detect fibrosis in liver. So which of the three is most important? Steatosis, inflammation, and fibrosis. And most of the studies have shown that it is fibrosis which progresses to cirrhosis and which progress to decompensation and liver cancer. So liver fibrosis determines the outcome, hepatic outcome in fatty liver disease. So if someone has got steatosis, I would be worried. But if someone has got inflammation, I would be more worried. But if someone has got high degree of liver fibrosis, I would be most worried. So to take home points, mast cell is not just a liver disease. We should not ignore it. We used to ignore it that, okay, fatty liver sabko hota hai. That should not be criteria. Mast cell has a bidirectional relationship with diabetes as well as obesity. So all patients of diabetes or obesity must be screened for mast cell. This will be a debate also here. All patients of mast cell must be screened for diabetes and obesity. Then mast cell patients are at very high risk of CVD, cardiovascular diseases. So all patients of mast cell should at least have a ASCVD screening using various risk calculator which are available. And then liver outcome in mast cell is determined by liver fibrosis. So we should at least screen these patients of diabetes with mast cell using FIB4. And if fibroscan is available, then nothing beats it. Thank you for your